What is a CBC? CBC means complete blood count. It is a test that counts the cells that make up your blood, RBC, WBC, and platelets. Your doctor may order a CBC as part of a routine checkup or to check for anemia, a condition that causes you to have fever or red blood cells than usual. Find out if you have another health issue or to explain symptoms like weakness, fever, bruising, or feeling tired. Keep an eye on a blood circulation condition. See how medical conditions, or treatments like chemotherapy are affecting your blood. How is a CBC done? If the CBC is the only blood test you have been asked to uh, get it done, you can eat and drink like you usually would. But part of the test is simple and takes just a few minutes. A nurse or lab technician will take a sample of blood by putting a needle into a vein in your arm. Afterward, you can leave and get back to your routine. They will send the blood to a lab for review. What does a CBC measure? The test can tell your doctor a lot about your overall health. It measures TC, or total count, which is going to measure the number of white blood cells. This count, if high in number, is indicative of an infection. DC is the differential count. It's going to measure the structure and consistency of the WBCs. It also counts the percentage of basophils, eosinophils, neutrophils, monocytes, lymphocytes. ESR levels, erythrocyte sedimentation rate. These ESR levels are going to check for the inflammation in the body. The test can tell you, doctor, a lot about your overall health. It measures the values given in this diagram. For example, the TC, the total count 4,000 to 11,000 per microliter. It varies for the infants. 1 year baby is something around 6,000 to 16,000 per microliter. At the birth, it will be 10 to 25,000 per microliter. In pregnancy, it is 12K to 20K per microliter. The hemoglobin count will be 13 to 17 for male, and 12 to 15 for female. And RBC is 4.5 to 6.5 into 10 power 12 per liter for males, and 3.8 to 5.8 into 10 power 12 for females. PCV is 40 to 54% in male and 37 to 47% in female. MCV is 80 to 100. MCH is 0.4 to 0.5 or 27 to 32 in PG scale. MCHC is 30 to 35 gram per deciliter. Then we also have certain parameters like normal reticulocyte count, which is 0.8 to 1.5% range. RDW, red cell distribution width, is 11.5 to 14.5%. Then you have the respective WBC components like neutrophils, lymphocytes, eosinophils, basophils, monocytes. So they have the respective values of 40 to 75, 20 to 50, 1 to 6, 0 to 1, and 2 to 8. Then there are two methods to find out the ESR, Winthrop's methods and Westgren method. So it depends on the lab and the technician and their preferred approach. So many of here in India, we see many of the labs, they use the Westgren method. Also, I've seen the Winthrop's method used. So the value changes accordingly. ESR 0 to 9 for men. So there's a formula, age divided by 2 here, and 0 to 20 mm per hour for female, age plus 10 divided by 2. So the same here with the Westgren method is 0 to 15 mm per hour for men and 0 to 20 mm per hour for female. CRP is 0 to 3 gram per PL. So now, what else might my CBC tell me? Your doctor might order more results to learn whether you have an illness or blood condition, including these MSMCH, for example, mean corpuscular hemoglobin, MCH. This is going to tell you how much hemoglobin is in your typical RBC. Next, it may be MCHC. MCHC is a mean corpuscular hemoglobin concentration. This measures the concentration of hemoglobin in a certain amount of blood. Then it may be reticulocyte count. This test measures the number of new red blood cells in your body. Then RDW, the red cell distribution width. So this shows how much your RBC vary in size. Then you have the MPV, mean platelet volume. This result gives the average size of the platelets in your blood. So the platelet distribution width, PDW. So this shows how much your platelets vary in size. Then you have the white blood cell differential. There are 5 types, as we are seeing in this diagram: basophils, eosinophils, lymphocytes, monocytes, and neutrophils. So what abnormal results mean with respect to these? Any infection or acute stress increases your number of WBC. High white blood cell counts may be due to inflammation, an immune response, or blood diseases such as leukemia. It is important to realize that an abnormal increase in one type of WBC can cause a decrease in the percentage of other types of WBCs. An increased percentage of neutrophils may be due to acute infection, acute stress, eclampsia, that's seizures or coma in a pregnant woman, gout, a type of arthritis due to uric acid buildup in the blood, acute or chronic forms of leukemia, myeloproliferative diseases, rheumatoid arthritis, rheumatic fever, that's a disease due to an infection with group A streptococcus bacteria. Then thyroiditis, a thyroid disease, trauma, cigarette smoking. So these are all the reasons for increase in the percentage of neutrophils. So, and a decreased percentage of neutrophils may be due to aplastic anemia, chemotherapy, influenza, that is flu, radiation therapy or exposure, viral infection, widespread severe bacterial infection. So these are the reasons for neutrophil decreased percentage. Next, let's see about the lymphocytes. An increased percentage of lymphocytes may be due to the chronic bacterial infection, infectious hepatitis, that's liver swelling or inflammation from bacteria or viruses, infectious mononucleosis or mono, that is viral infection that causes the fever, sore throat, or swollen lymph glands. Then lymphocytic leukemia, a type of blood cancer, multiple myeloma, a type of blood cancer, viral infections such as mumps or measles. Similarly, if the percentage of lymphocytes is decreased, it may be due to the chemotherapy, HIV or AIDS infection, leukemia, radiation therapy or exposure, sepsis. Sepsis is nothing but the severe inflammatory response to bacteria or other germs. Then the more steroid usage. An increase in the percentage of monocytes may be due to chronic inflammatory disease, leukemia, parasitic infection, tuberculosis, or TB, that's bacterial infection that involves the lungs. And the viral infection, for example, the infectious mononucleosis, mumps, measles, etc. So an increased percentage of eosinophils may be due to the Addison disease, which is adrenal glands do not produce enough hormones. Allergic reaction, cancer, chronic myelogenous leukemia, collagen vascular disease, hypereosinophilic syndromes, parasitic infection. So these are the reasons for eosinophils increase. And an increased percentage of basophils may be due to the after splenectomy, allergic reaction, chronic myelogenous leukemia, a type of bone marrow cancer, then collagen vascular disease, myeloproliferative diseases, a group of bone marrow diseases, chickenpox, etc. A decreased percentage of basophils may be due to the acute infection, cancer, or severe injury. Then we have two major tests, which is CRP and ESR. So these two are among the most widely used diagnostic tests in detecting inflammatory conditions that may have caused by infection, autoimmune disorders, malignancies, or tissue necrosis. The CRP test measures the level of a plasma protein, that is C-reactive protein, that is CRP. So that CRP protein produced by liver cells in response to acute inflammation or infection. Unlike CRP, which is a direct measure of inflammatory response, ESR is an indirect measure of the level of inflammation in the body. ESR measures the rate at which red blood cells settle in a specially designated tube of anticoagulated blood, an effect that is altered by proteins associated with an inflammatory response. Both CRP and ESR are usually increased in acute inflammatory conditions. However, patterns of response are different for each test. CRP rises within hours of onset of an infection or inflammatory condition and returns to normal within 3 to 7 days if the acute process is resolved. ESR, on the other hand, increases in a slower manner and remains elevated for a longer period of time. In addition, ESR is a non-specific measure that can be affected by factors other than inflammation, such as the shape, size, and number of RBCs, levels of serum uh, fibrinogen and immunoglobulins, renal function, age and sex, pregnancy, and use of medications. Because of these differences, CRP testing is often chosen over ESR in the assessment of early inflammation. However, there is no consensus on which single test is preferred, and as a result, physicians often request both tests. Thank you. In the upcoming videos, we will see some more information on all normal lab values for the common lab values like LFT, renal function test, lipid profile, coagulation screening, etc. Thank you.